Hi, this is Dr. Kaan at ACL Academy, and today I'm back with another video. And we're going to speak about compression wraps and what's the proper way to wrap our leg after surgery. After your surgery, you're going to be sent home with a bunch of bandages and also with your leg wrapped up. So these wraps are great because they provide some compression. They help control swelling. Problem is they get loose over time, and you're going to have to change your dressings. You're going to have to take these bandages off to do your exercises. It's important that you know how to rewrap your leg to help provide that compression. It's important, especially for the first 10 days or so, especially as the incisions are still healing or you still have sutures. You'll be utilizing this to help with swelling control. And really, you may not be educated on how to wrap or the proper way to wrap or how often to rewrap. So in today's video, I'm going to touch on all that and more. Before I get further into that, guys, if you've been following along with the ACL Academy page and you found some value here, please subscribe to the channel. Please like the video. If you have any comments, questions, drop them below. And of course, share with the fellow ACLs that can benefit from these tips and education. So let's get right into it. Really, leg will be probably wrapped up in two of these short wraps, or sometimes it'll just be one longer one, depending on the size of your leg and what's available, what they have. So I'm going to show you this two-step variation here. Really, the trick is you want to make sure you have some sort of pillow to prop up your leg, so this way there will be some space, right? So because this is my leg here, it'll be hard for me to wrap it, especially when I don't have much control of it early on after surgery. It's very weak. So what we're going to do is you're going to use a pillow, place it under the ankle, right? So this way there's some space to where you're working. And what we want to do is wrap basically from mid-calf to around mid-thigh. And we're going to start below and then slowly work our way up. One important thing that we want to note is you never want to wrap like straight across the leg, right? We always want to wrap in more of a diagonal type fashion. And we're going to work up and down in figure eights until we get all the way up to the thigh here. So basically the first placement, maybe on the middle calf here, we're going to come overlap the starting point so it doesn't slip out. And then we're going to work up and then back around the leg and then down. Okay, so this way we get our figure eight type crisscross motion. And then you just want to take up the spaces that you didn't fill yet. Okay, up and then back down. And I put a little bit of tension, right? I'm not yanking the band, but I'm still putting a little slight bit amount of tension there. So this would be a full pull. So we do about 50% of that. Okay, so this way it is snug, but it's also not like super restricting. And then when I get to the other bandage, instead of like having to clip this one too, what you can do is just kind of place right over that one area. So this way it covers that spot, and then you don't have to worry about it slipping out from underneath you. And you don't have to be worried about clipping twice. Okay, so again, we're kind of working our figure eights up and down and using more of a diagonal pull. And then once we're finished, you'll be provided with either clips, and if you don't like the clips, you can use any type of like medical tape is fine. That will hold it in place. And what you want to look to do, the most important part of all of this, right, is to make sure this is snug. After a couple hours, it'll start to get loose, especially if you start to move your knee around, it'll start to fall off. So what I would encourage, every 2 to 3 hours or so, you should rewrap. And you can take this off to do your exercises, you can take it off to do the dressing changes, but once you are relaxing and sitting and you're getting the leg, and you're going to get the leg elevated, make sure you rewrap and make sure it's nice and compressed. Once the sutures come out, once things start to heal though, you'll probably switch over to like any type of sleeve like this, I recommend neoprene sleeve. There's not necessarily a brand. You can go on Amazon and find these sleeves for $7, $8. You can find this brand is Incrediwear. This brand goes for $40. So there's all ranges. It's just really important as the compression piece, right? If you want to control swelling, elevation and compression are the two most important things. And like I said, in the beginning, when you're first getting out of surgery, you will be with these wraps, and it's kind of your job to rewrap because you won't be able to get a sleeve like that on. Um, so you want to make sure that you learn this the proper way, um, and that you can rewrap yourself, and it's snug and it stays snug, and it controls that swelling. So guys, I hope you found some value out of these videos. If you have any questions, drop them below. Happy to touch on them. And if you can, subscribe to our channel. And most importantly, share with a fellow ACLer that can benefit from these tips. I'll see you here next time at the ACL Academy. This is Dr. Kaan.